Let's go back in to the courtroom. The orthopedic surgeon now is on the stand. Let's go in together.
Doctor, could you tell the ladies and gentlemen of the jury your full name, please?
Sir, it's Romney Andersen.
And you are a medical doctor?
Yes, sir.
What is your specialty?
Orthopedic trauma.
I want to go through briefly, if I can, your resume, curriculum vitae, so the jury will understand your expertise, if I could. When did you graduate from med school and from where?
1996 from the Uniformed Services University of the Health Sciences.
I did want to ask one question. You have a Bachelor of Science degree in what?
Nuclear physics.
And then you decided to go to med school after that?
I spent 7 years in the infantry, and then I went to medical school.
All right. Now, I want to talk to you about the different jobs you've held as an orthopedic surgeon. I take it you became board certified in orthopedic surgery at some point in time?
Yes, sir.
And where have you worked in the field of orthopedic surgery?
So once I finished residency, I went to fellowship at the Shock Trauma Center in Baltimore for a year's fellowship in orthopedic trauma. Then I came back to Walter Reed during the war and helped out with the trauma there. During that time, I worked 1 weekend a month up at Shock Trauma, helping them out as well. And then I worked at a number of little various hospitals doing hip fractures and things on the weekends to help them. When I retired from the military about 11 years ago, or 10 and a half years ago, I came down here to Newport News and currently work at the Riverside Regional Medical Center.
Did you become the chairman of the Department of Orthopedic Surgery at Walter Reed National Hospital?
Yes, sir. I did that for the last 6 years I was there.
And are you the chief orthopedic surgeon at Riverside Health System?
I gave that up recently.
But you were chief for how long?
I did it for a decade, then gave it up.
Have you published in the field of orthopedic and orthopedic trauma?
Yes, sir.
Without going through what appears to be a lengthy resume, could you give the ladies and gentlemen of the jury a rough idea about how many articles you have written, how many chapters of books have you written on orthopedic trauma?
I haven't reviewed that recently, but there's probably 70 to 80 peer-reviewed publications, 10 to 20 book chapters, and then there's some other articles as well, and there's probably 100 total publications.
Have you been working in the field of orthopedic surgery once you started? Basically, once you became chief of Walter Reed, since that time you've been an orthopedic surgeon?
Once I finished my orthopedic fellowship, that's what I did, yes. And during residency, I just did orthopedic surgery.
And you've been in orthopedic surgery, you've been treating regular patients since that time?
Yes, sir.
Your Honor, at this time, I'd like to tender Dr. Romney Andersen as a specialist in orthopedic trauma.
Any objections?
No objection.
Without objection, so qualified.
Dr. Andersen, I take it you were working at Riverside Hospital when Abby Zwerner became a patient?
Yes, sir.
And I'm going to try to walk through what you've done with her surgery, but your primary focus, I believe, was on her hand?
Yes, sir.
And when you saw her for the first time, was that on January 6th or on January 3rd? Yes, feel free to review any of your medical records or notes. We had, just so you understand, Dr. Munn testified, who was the chief trauma surgeon at Riverside, who I know did see her with the other trauma doctor. At some point in time, I believe they testified that orthopedics needed to come in to work on her hand. I'm trying to determine whether you were on January 6th or on January 7th, if you know.
I believe I saw her in the intensive care unit on the 7th of January. The morning of the 7th of January.
Tell the ladies and gentlemen of the jury, if you would please, roughly what did you see for purposes, and I'm going to go general and then I'm going to show you some medical illustrations.
Yes, sir. So it was
describe it for the jury, please, if you could.
Yes, sir. It's a devastating hand injury with a significant amount of bony injury or bone fractures, as well as a number of soft tissue injuries that were associated with that.
When you say soft tissue injuries, just tell the jury what are soft tissues of a hand. Not the skin, I take it.
There's skin, muscles, ligaments, joint capsules, nerves, blood vessels.
And have you seen those types of injuries in your past?
Yes, sir. This, we take care of a lot of stuff at Riverside Regional Medical Center, but on a, if you stratified these in a scale of 1 to 10, this was a more closely associated with a 10 type injury, which we were seeing frequently during the war.
And what war were you treating orthopedic surgeon injuries with bullet wounds?
OEF, OIF, and Iraq and Afghanistan.
All right, I have shown you and shown counsel before some medical illustrations that were based on x-rays as well as surgical reports, and you have seen them, I believe?
Yes, sir.
Without, it's MV1 through MV9? I'm going to show them to you as a group first, and it'll help us move faster. May I approach, Your Honor?
You may.
Are these the medical illustrations that were shown to you, and do they accurately reflect Abby Zwerner's injury, and would they help you in trying to describe to the jury your treatment of her?
Yep. Yes, sir. These are the ones I reviewed.
And I have MV1, please.
Now, are these going to be offered into other?
These are for demonstrative purposes
These
only,
are
Your Honor.
demonstrative as well. All right, so they're not going back to the jury room, okay? Any objection, by the way, Ms. Douglas?
Not to the demonstrative.
Okay, thank you.
MV1 can be published to the jury. At some point in time, and I believe it's on your screen as well, Doctor, and at some point in time I might ask you to step over to the screen, but for now, they've got a large screen there. Could you tell the ladies and gentlemen of the jury what the upper left-hand, let's see if I can get this done. Am I doing it all right? Hold on one second. What does this picture show us of January 6, 23? This is an actual X-ray of Abby's hand, correct?
Yes, sir.
All right, now you'll see where there are lots of white spots here. Could you tell us what they are?
So the things that are bright white, those are more radio-dense, and so X-rays don't go through those, and they show up white. Those are metal fragments of the bone, of the bullet.
So
Excuse
those
me.
are the bullet fragments that struck her in the hand.
Yes, sir.
And all of those white dots are bullet fragments.
The dark, or the bright white. The more gray dots are bony fragments.
All right, let me look at, I take it on the bottom left, that's just a side view of the exact same bony fragments and metal fragments.
Yes, sir. A lateral view.
All right, so looking at this picture of January 6, 23, the medical illustration on the right, could you help us distinguish between the bones and the bullets in this diagram?
So the gray items marked as bullet fragments, those are the bullet fragments. The kind of yellowish tan flecks are bony fragments.
I may have trouble because I don't see yellow.
Or it's a gray, tan, whatever. The rest of the bones, like the finger bones, those little fragments that are a little redder down where all the bony breaks are,
Here,
there, that whole region, or if you'd like, I can come point it out.
I'm going to save you because I don't want you jumping back and forth because we have.
But all through that region you just circled are little bony fragments as well as metal fragments.
And what did you do as the orthopedic surgeon for that hand to try to stabilize Abby?
So the initial, when you see an injury of this magnitude, your initial treatment is not to get everything put back together right away. It's to stabilize things. So we brought her to the operating room for an irrigation and debridement. That is just to try and remove any contamination in there to reduce the infection risk over time. And then, as you can see, some of those bones have no stability at all, and some look like they're short. So we needed to bring those out to length and pin them so that when we went back to do definitive fixation, we'd have the bones out to length and they wouldn't be scarred and short.
When you say you lengthen them and then get them ready for, what are you using?
We use K-wires, just the smooth circular wires that you put in with kind of a drill, and then you cut them and bend them.
Now, I know this is surgery.
All right, now we're hearing about that devastating hand injury as a result of the shot fired by the 6-year-old. The question in the civil trial is, will the assistant principal be found civilly responsible and owing money. Stay with us. We'll get you back for more testimony when we come back. Welcome back to Court TV Live. I'm Judge Ashley Wilcott. Right now, let's turn back to Virginia for more of day 2 of the first grader shoots teacher civil trial. As part of a multi-million-dollar lawsuit, the teacher, Abby Zwerner, claims that an elementary school student with a history of issues shot her. We know that he did shoot her, but she says that former assistant principal Ebony Parker ignored teachers' concerns about the student and allowed others to get away with misconduct. Let's go back into the courtroom now, right where we left off. We're listening to an orthopedic trauma surgeon who treated the victim in this case, the plaintiff, and he is still on direct examination.
Now, I know this is surgery that she was undergoing, but you were not at this time fixing her hand for purposes of the things that you needed to do. You were just cleaning it?
Cleaning it and stabilizing it.
All right, what, describe for the jury, please, if you would, what are the primary injuries that Abby suffered from with initial injury January 6th that is visible, and then I'm going to show you soft tissue diagram next after the hard bone diagram.
So you can see at the base of the thumb, there's a fracture at the base of the thumb. Then if you go to the index finger.
And I take it if you'll let me guide a little bit. Base of the thumb is here.
Or that's the base of the thumb. You can see there's highly comminuted fractures there. If you move over to the index finger, the base of the metacarpal there's no joint surface even left. It's completely gone with a bone void there as well. And then if we go to the middle finger or the long finger, we can see that there's a large bony defect with highly comminuted fracture.
When you say you lengthen it, what do? You just pull it out and then put wire in?
Yes, sir.
All right, let me switch, if I could, to MV2, please. Should be on your screen. Now, these are the soft tissue injuries?
Yes, sir.
All right, and you tell me where you would like me to go so that you can explain to the jury what is the soft tissue injury. Let me start with the bottom, dorsal external appearance. That's the entry wound of the bullet.
The entry and exit, sir.
And let's move to the left. And I know we just looked at the bones of the thumb. If you could walk the jury from the thumb over to the right and tell us what we're looking at.
So let's start on the index finger. We can see that there was a complete rupture of both of those tendons that extend the finger. And that's where
When you say they're ruptured, tell me what's happened to those tendons.
Oh, I'm sorry. This is looking at the palmar. The picture on the left is looking at the palm. And so that
facing up towards your face,
looking at it like this. And so you can see that there's complete ruptures of the tendons of the index finger flexor digitorum superficialis.
You help us with that in terms that we may not understand.
Yeah, I'm sorry.
So this is a hand that's looking straight at my face.
The tendons on the palmar side of your finger allow you to flex the fingers. Each finger has 3 separate tendons. One is called the profundus. There's the superficialis, has 2 slips to it. The profundus goes all the way out to the end of the finger, which flexes the deep part of the finger. The superficialis goes around and comes into here, which bends at the, I guess you'd say, like the first knuckle. We could see that the index finger, the one that goes all the way out to the tip, was 25% lacerated.
Which finger?
The index. And then the flexor digitorum superficialis, 10% lacerated.
All right, now let's go to the far right.
Yes, sir. So this is looking at the hand like this. Looking at the back of your hand like this.
And so her thumb would be on the far right of this right diagram.
Yes, sir.
Tell us what we're looking at.
So the first thing on the top there talks about laceration and contusion of the posterior interosseous nerve. That's a nerve that goes out from your forearm across to the wrist joint, and that's what gives your wrist innervation, or it gives you sensation of the wrist.
And what happened to her nerve?
It was transected and contused.
When you say transected, for our purposes,
Cut. Yeah.
Just trying to help make sure we all understand.
Right.
Keep
so,
on moving, right to left.
And then as we go to the right, we see that there's
To the left.
from the small finger to the thumb, as we move from left to right, there's a 75% laceration of the finger that, or the tendon that extends your finger independently. So most of your fingers have a common tendon that helps you extend all your fingers at the same time. The index finger has a separate tendon so that you can point. Like, it's very difficult to point with your fourth or middle finger. It's hard to pull that finger up by itself, but you can do it with your index finger because it's got a separate tendon, which is the extensor indicis proprius.
What happened to Abby's tendon?
It was 75% transected, which if you don't do anything with it, tends to rupture.
I keep on going. I take it all these great things, or what?
That's bullet fragments.
I keep on going.
So as we go to the right, we see that there's a tear in the thumb joint capsule at the base of the thumb, and
is that here?
yes, sir, right about there. And then there's a dorsal retinaculum tear. And so if you take your fingers and you go like this, the retinaculum, if you can see the tendons on the back of my hand.
See the back row there? You need to live a little bit higher for. And
so the tendons, you can see them kind of on the back of my hand. The retinaculum holds those down tightly here so that they pull the fingers up. If that retinaculum wasn't there, these tendons would do what we call bowstring, and it would try and go from here to here and just lift up and not lift the finger as well. So that retinaculum keeps the tendons in place so that they have a mechanical advantage to extend the fingers. That was torn.
all right, anything else here that needs to be seen?
No, sir.
All right. This is all as of January 6th and 7th of 23, correct?
Yes, sir.
Did you decide and make a plan for surgery?
Yes, sir.
And when were you going to plan to do your first surgery? On the 7th?
No, we did. Well, the first surgery on the 7th was
To do the wires.
to stabilize that we've already talked about. Yes.
Did you decide when you were looking at Abby's injuries to bring in another doctor to assist you with the surgery that you needed to perform?
Yes, sir.
Who was that doctor?
Dr. Scott Tintle.
And could you tell the jury, please, why you brought the doctor in and where did he come from to assist?
So Dr. Scott Tintle was one of my residents at Walter Reed when I was the chairman there. He had went on to do hand surgery, but he and I did a number of the more difficult hand surgeries at Walter Reed. And so when I was looking at this, I was like, this is much more similar to a war injury than it is what I normally see. And having a second set of competent hands in the operating room is very valuable when you're taking on a problem of this magnitude. So
Still with us, criminal defense attorney Eric Puryear. Eric, just hearing what he said at the very end right there before we came out, comparing it to a war injury, the hand injury that the plaintiff suffered. Again, it's not just, oh, I was shot in the hand, I had to have a surgery. It was a devastating injury caused by the shot fired by the 6-year-old. And does that add to the case that the respondent, the assistant principal, should be responsible for the shooting?
Oh, I think it's going to do exactly that in the jury's mind here. You know, the doctor described it as devastating. He talked about the bullet fragments everywhere, the need to bring in another surgeon who has experience dealing with war injuries. That is very helpful for the plaintiff's case and not so much for the defense.
Yeah, and as we're listening to this unfold, I think the plaintiff, obviously, they are all good attorneys on both sides. They've demonstrated that. But the way that the plaintiff has chosen to put the case out there, having that firsthand testimony from other individuals who worked in the school, who were there, who were eyewitnesses, who were told, the one who was actually told by another child that this 6-year-old had a gun at school, all of those steps, laying the groundwork, and now moving through that, hearing from the mother, talking about her daughter, and now moving to the medical testimony, the experts about, again, these were not just minor injuries, these are injuries that have lifelong effects.
Oh, most definitely. This is an expertly conducted case by the plaintiff and the defense, but the plaintiff seems to have the evidence more on her side here, and stepping through it in that fashion, helping the jury see each of those points, especially the way that the investigation into whether the student had a gun was brought to a halt. All of those sort of things, coupled with the seriousness of the injuries, both what happened and the future, I think it is an excellent case being put on by the plaintiff here.
Yeah, and just a reminder to our viewers, a lot are saying on social media, why in the world is she the only one sitting there in that spot, and they're asking for $40 million from her? Well, first of all, the $40 million was an ask when a school board and other individuals were included in the lawsuit right before trial. The judge said that was simple negligence argued against them, and they are immune from that, and therefore they're dismissed from the lawsuit. So I don't expect, if this person is found civilly liable by the jury, I don't expect they will request the full $40 million. Just really quickly, I know we have to get to a break. Do you think they will or not?
Well, that's a tough one to say. I think that the evidence that we're seeing here, both from the injury and the future, is significant enough that depending upon how the jurors feel in their hearts, it's going to be interesting. All
right, it could be then. Stay tuned. We're going to take a break. When we come back, we're going to get you back into this trial.
I ended up asking him if he loved me. He said, I don't know. I said, do you love her? He said, I don't know.
That set you off?
Someone was stabbed?
Yes, she's on the floor.
I didn't have the intent to kill Sarah. I really just wanted to scare them.
It looks more like fury than fear. Did you kill Sarah to possess what she had with Josh?
Sorry.
Interview with a Killer. New episode Saturday night at 8 Eastern and Pacific. Only on Court TV.
Back now to Virginia for more of day 2 of the civil case between a former assistant principal and a former elementary school teacher, Abby Zwerner. The $40 million lawsuit stems from an incident back in 2023 when a 6-year-old student shot Zwerner in her classroom. Her attorney says that their client, other teachers, and even students warned school administrators, specifically the former assistant principal, Ebony Parker, that the 6-year-old had brought a gun to school and that those warnings were ignored. Let's head back into the courtroom together now and pick it up right where we left off with more from orthopedic trauma surgeon Romney Andersen.
I contacted the administration. They said, be happy to let you bring this guy in. We got him credentialed in a few days, and he came down and helped us with the case.
When did you do your first surgery post wiring of her hand?
I refer to my notes here.
And I'll direct you to January 16th of 23 if that will help you.
Yes, that's when we did the next surgery. It was the 16th of January.
MV4, please. And feel free to refer to your notes at any time to any of the issues involving.
Yes, sir.
The first issue, I believe, is a left-hand gunshot volar wound. Tell me what that means.
Volar's the inside, dorsum's the backside. So there's a gunshot wound there.
All right, let's talk about the frame A of the January 16th, 23, part 1.
Yes,
tell
sir.
the jury, please, what we're looking at in A.
So oftentimes people hear about people that get carpal tunnel syndrome from like typing too much or things like that. That's that this transverse carpal ligament that you can see being cut in this picture is. Right there, right. You can also get it from traumatic injuries. We knew from the radiographs that there was a large bullet fragment in there, probably irritating the median nerve, so we needed to go get that out.
And so the purpose here is to just remove the bullet fragment.
Remove the bullet fragment, give the median nerve more room to kind of live in a traumatized hand.
All right, let's go up to B, please, and tell the jury what we're looking at here.
So we've just reflected the transverse carpal ligament, and then we remove the bullet fragments in there.
All right, C, please.
So one of the tendons that flexes your finger was lacerated as well, so we repaired that. Flexor did the
So where am I looking here? I see that the skin's been pulled back, and then I see a pinching device holding it on the right there.
Right where that arrow points is where we repaired the tendon. You can see the little sutures in there.
Right there.
Yeah.
All right, and so what was the primary purpose other than removing of the bullet fragment of the carpal tunnel area?
Make more room for the median nerve and repair the tendon.
All right, let me move to MV5, please. Tell the ladies and gentlemen of the jury, what are we looking at here? And I take it this is also on January 16th, 2023. We are deeper. Am I on the left-hand side? Am I looking at the top of Abby's hand or the underside of her hand?
So the left picture is looking at the back of the hand.
Back of the hand, I'll use that. Tell us what we're looking at here.
So we see that there's more bullet fragments there that we took out.
Which are all in here?
Those little gray things, yes. And then we see the laceration to the tendon that extends your finger independently.
Right there?
Yep. And then on the picture on the right shows us repairing
Before you get there,
tendon.
that in the middle there, which I'm messing up my little knee, I'm going to start again. There you go. Those are all bullet fragments that you pulled out of the hand?
Yes, sir.
All right, tell us what we're looking at here on E.
That's just repairing of the tendon that we saw lacerated on the left.
So it calls it the
extensor indicis proprius.
Right. What is that specifically? Because I'm not sure I heard those terms.
That's the tendon that by itself is responsible for extending the finger so you can extend the index finger independently of the other fingers.
And what are you doing in this surgery here?
Oh, bringing the ends of the tendon back together and sewing them together.
Does scar tissue normally form in those areas?
Frequently.
And does the scar tissue cause problems and or future problems with someone like Abby?
It causes the inability to flex down all the way because the tendons on the back are scarred in. And on the palmar tendons that were repaired, makes it hard to extend the fingers.
Let me move to MV6, please, and tell me what we're doing here.
So,
and I'm going to start off at F. We can zero in on F because it's real fast.
So on the back of the hand is where we fixed the index and middle finger metacarpal. This is a picture of fixing the middle finger metacarpal. We put a plate over the area. You can see that there's a large bone void underneath those screws.
So this is a plate, or are those? What is that? Because I see a screw being put in.
That's a metal plate and metal screws that we're putting in there.
And is that to take the place of the bone that was removed by the bullet?
And to hold it stable, yes.
All right, move
to try and help it heal.
Obviously, it's not a final fix. It's to try to get something.
Yes, sir.
Move to the same picture, but go to G, please.
So in the picture in G shows that we've already fixed the index finger metacarpal.
Point to the jury again which one we're talking about so they can see on your hand where we're talking.
This finger right here.
All right, is this the same plate or a different plate?
That's a different plate. There's two plates in there. You see one kind of hiding out under the tendon on the left side of the screen.
Behind there.
That's one that
we'll have more testimony in the first grader shoots teacher civil trial. Stay with us. We'll be right back here on Court TV, your front row seat to justice.
I just remember her facial expression. It was kind of like a look of shock.
And is that one of the reasons you didn't have a good feeling?
Probably.
Did you hear the
Yes.
shooting?
Yes.
Okay. Once you heard the shooting, what did you think that was?
I knew it was a gunshot.
And where did you think it had come from?
Abby's room.
Hard to listen to. Welcome back to Court TV Live. I'm Judge Ashley Wilcott. Of course, I'm honored to be with you as we are bringing you this case out of Virginia this afternoon, where a jury is weighing a multi-million-dollar lawsuit filed by a teacher who was shot by an elementary student who was only 6 years old. Abby Zwerner was teaching her first day class when that 6-year-old male pulled out a gun and shot her in January of 2023. Now she is seeking compensatory damages of $40 million. Zwerner claims that the assistant principal, Ebony Parker, ignored the student's history of violence leading up to the shooting and that she neglected to protect her as a teacher. Parker's defense, on the other hand, says that the teacher, Zwerner, had a duty to account for her own safety that day. Let's get you back into court now to hear more from orthopedic trauma surgeon Romney Andersen.
Yeah, that's one that was on the other image. This one right here is for the index finger. And this one had the index finger, where you're pointing right there, had such bony destruction it took out the whole joint space of the proximal part of the metacarpal. So the trapezium.
When you use those terms, proximal, could you explain to us what we're talking about on a hand for us?
Closer to the wrist. It took out the whole joint in there, so we had to do a fusion down to the trapezium.
And when you say
trapezoid,
the bullet just removed the whole bone.
It came out and spit it out across the floor wherever, and it went out when the bullet went in and took bone with it out the backside of the wound.
All right, tell me what we're looking at here.
And this is the thumb, where we had to fix the thumb fracture as well.
And again, another plate.
Another plate and screws, yes. And we also had to do the joint capsule was gone down there as well, so we had to put in a suture anchor to sew the capsule and ligaments down there.
All right, let me focus you on that for just a second. This is a suture anchor. Where is that going and what is it doing?
It's going down. Across your wrist and go into the carpal bones, or those are all the kind of intermediate bones in here that allow you to bring your wrist up. Those had both been completely transected. They're very difficult to sew back into bone, so we put an anchor into the bone and then sew the sutures on the anchor. So if you look at that picture where it says suture anchor, there's some suture there. Down, right there. We take those sutures and tie it into those tendons, so now that when those muscles fire, it brings the wrist up.
Now, in looking at the notes, there appears to be some non-biodegradable drug delivery antibiotic spacers, I believe, for what they are.
Yes,
Could you
sir.
tell the jury, please, what the purpose? What are they? What are antibiotic spacers, and what is your purpose of putting them in the hand?
So, when you have an injury this devastating with bone loss, you're going to have to come back later and do a bone grafting procedure. If you let that just all fill in with scar, it doesn't leave a nice pocket to put the bone graft in. And so we put in this, it's bone cement that people use when they get a total knee or a total hip. We fill it full of antibiotics. Those antibiotics leach out over a several-month period of time, so it helps fight infection as well.
So it's basically a time-release capsule that's buried into the hand to let out antibiotics to stop the infection. Let me go to MV7, please.
And in that, we put vancomycin, gentamicin, and tobramycin, three pretty hefty antibiotics to try and
keep the infection from happening.
Keep the infection from occurring.
The risk of an infection to Abby at this point in time is?
It can be devastating.
I believe I am on MV8. 7, I mean. Tell us what we're looking at here. This is, I take it, post-operative, so you finished your surgery. I'm going to start with frame I, please.
So the thumb tendon, there's a sheath that thumb tendon runs in, and we that was all damaged, so we took it out of the sheath and just moved it over so it wasn't captured in this damaged sheath.
I take it these are all these are what you've placed in there to help with the bones.
Those are the plates for the bones, yes.
And you've moved soft tissue tendons so that they can be free of the damaged area?
Yes, sir.
What is on the far right?
That's just the same thing.
All right.
You can see the incision being made in the extensor pollicis longus tendon sheath on the left, and then on your left picture where the knife is,
okay.
You can see that that's taking the sheath that was damaged, opening it up, and then taking the tendon out and moving it over.
And then where is I'm looking at here? Where
it's just a little bit more to the right of the screen than it was on the left.
Gotcha.
You can see the empty sheath behind the tweezers there.
Gotcha.
See that?
Here?
Go to that right behind the tweezers is the empty sheath. Yep, right there, right there, yeah. Right there. And then the tendon is moved over, so it's not in that damaged sheath.
All right, the next part of that slide, please. So tell me what I don't think we need to see it. Well, let's look at Jay real fast.
So when we talked about the tendons having a tendency to bowstring without that retinaculum, we had to repair the retinaculum there.
And that's what you're doing here?
That's what we're doing there, yes, sir.
All right, let me go to the x-ray on this same slide right here. All right, so this is post-surgery, I believe,
yes,
January 16th, 2023. And you are looking here at all of the hardware that you put in there.
Yes,
right?
sir.
Tell me what these... I think I know what they are, but I'd rather you tell me. What is all this kind of reddish area here and around there? What are we looking at there?
Those are fractured bones.
And why are they left there in that kind of condition?
Well, if they've got some soft tissue attachments to them, then they've got a chance of healing in. So it's best not to take out things that you think are viable that can help the bone heal.
All right, I take it you continue to operate and work on her, and I believe your next surgery is on March 16th, which would be MV8.
This is still the same. This is March 16th.
March 16th?
Yes. So.
All right. So let's talk about A first. What are we looking at here in the upper left?
So she had these bone voids in her hand. In order to get bone to fill those gaps, we have to get bone from somewhere. We have to steal from Peter to pay Paul. So we go into the hip where there's good, the bone in the hip has very high amounts of bone growth factors in it. So when we take that type of bone, we get better healing. So that's why we made an incision over the hip, made a little window in that iliac bone, went down and took out a bunch of bone, put it on the back table, and closed the wound.
How do you take the bone off of her left iliac crest?
With chisels and hammers and chisels.
And what are you left with when you do that? Just pieces of...
Well, you leave the soft tissue attached on one side, so it's kind of like a window, and then you bring it back down and sew it into place.
And what are the bone pieces that you've removed? Are they broken bones? Or are they
No, it's just
what
the bone marrow from the inside of the pelvis.
All right, let's move to B, please. All right, so I see here, and so that is the antibiotic spacers that you had placed into the earlier surgery?
Yes, sir.
And why are you taking them out now in this date?
So we're taking them out now. Now there's a void there in the ends of the bones, and that's where we pack the bone grafting.
All right, let's move to C, please. Of that same. So I see this tube here, the blue arrow, and then I see what looks like something you're about to punch into that. That is the bone graft from the hip?
Yes, sir.
And tell the jury, please, what do you do with that bone graft in that tube there?
We just pack it in the void between the two ends of the bone.
And how do you keep it from coming out?
Well, that's what putting the antibiotic spacer in it kind of creates a rind around the edges of it, and it makes a nice void to contain the bone graft.
Now, I don't have graphs to show it, but there appeared to be a third surgery in February of 2023 and one on March of 23 that had to do with manipulation. Could you tell the ladies and gentlemen of the jury, what do you do and under what circumstances do you put Abby for those other surgeries?
So when you have bad injuries like this, there's oftentimes a lot of scarring that goes in and around the tendons you've repaired and things. She had kind of hit a plateau with regard to therapy, so we discussed with her and then brought her to the operating room to do what we call manipulation under anesthesia. So we put the patient to sleep so that they can't feel anything and then push like crazy to get.
And this is why this doctor previously described this hand injury as a war injury, as bad as that. Coming up next, we'll have more testimony in the first grader shoots teacher civil trial, plus an update on our other live trial happening in Wisconsin for Matthew Paul, the man charged in the mysterious death of his girlfriend. That's up next. Stay tuned.
6-year-old shot his teacher. Their side battling that it is part of the job. Just outrageous.
The first grader shoots teacher civil trial. Live coverage today on Court TV.
Tonight on Closing Arguments, 5 men sentenced after 4-year-old Sonny Bell was killed in a drive-by shooting. We'll show you powerful victim impact statements from today's hearing.
Closing Arguments tonight at 8, 7 Central, only on Court TV.
Back to the shot by first grader civil trial in Virginia in just a moment. But first, we want to bring you an update on another trial that we are tracking here at Court TV. This is the bad boyfriend murder trial of defendant Matthew Paul in the state of Wisconsin. Matthew Paul is accused of killing his girlfriend of 20 years, Stephanie Pavlons, and then dumping her body in the woods. Earlier today, jurors heard from a crime scene analyst who testified who tested the defendant's truck for traces of blood.
Did you in fact test 3 areas using a presumptive test from the interior of the vehicle?
Yes, we did a presumptive test on 3 areas within the vehicle. All 3 of those tests were negative.
Moving now to the bed of the truck, did you do the same thing in the bed of the truck?
We did. There was an area that resembled like a wettish stain. And so I swabbed a little portion of that and put it to the same presumptive test. It ended up being negative.
Negative for her blood, a possible win for the defense with that fact. We're going to continue to follow this trial and bring you any important updates as they happen here on Court TV. So let's now go back to Virginia, where a teacher is suing a former assistant principal for $40 million. 28-year-old Abby Zwerner is suing then assistant principal of Rich Neck Elementary School, Ebony Parker, for millions after she says that Ebony Parker failed to act when a 6-year-old brought a gun to school. That 6-year-old had a history of violence and had been out from school the day before on suspension for throwing a teacher's phone on the ground. Let's go back into court now, where an orthopedic surgeon is detailing the hand injury that Zwerner sustained after the shooting.
And why do you have to do that under general anesthesia?
You can't tolerate that without anesthesia.
So are you worried about damaging the bone repairs that you've done when you're doing that, or are you just focusing on the manipulation so that there's movement of the hand?
It's a balancing act. You know, certainly if you put too much pressure on it, you could bend one of the plates or break the bone and the plate. So it's, you know, after you've done this a number of times, you get to a point where you feel like I just can't go any farther. But we got good manipulation out of her without breaking any bones.
And how many times in February, March did you put her under general anesthesia? Twice for purposes of that manipulation?
We did it once, but the second time we did, we were going in to take out the plates and repair a tendon that had started to lag.
What was your plan and what was Abby's duties for purposes of your treatment between that time, February, March, up until October of 2023? What was she supposed to be doing, and was she doing as far as
she was aggressively working with occupational therapy to work on range of motion and strengthening
And what's the difference between what they're doing and what you did under general anesthesia, manual manipulation?
It's similar. We know that the scar tissue fails by what we call fatigue failure. In other words, if you take a paper clip and bend it once really hard, you're unlikely to break it. But if you sit there and just bend it back and forth, back and forth, back and forth, ultimately that paper clip will break. The scar tissue does the same things. The more you can get them to move, and frequently I'll tell patients with this type of problem, you're reading a book, watching TV, I just want you to move and move and move and move. The more they're moving, the better they have of breaking up that scar tissue.
Now, my memory from looking at the surgery from this March 16th, there was something regarding the tendon itself pulling apart. Do you remember that?
Yes. So
tell the jury what that means and what it meant for Abby.
So, Abby, the tendon that extends your fingers to be able to bring them up, the tendon to the middle finger had done what we call attenuated. In other words, a tendon has got a bunch of collagen fibers that are all hooked together. It had slowly pulled apart and was longer. So when Abby would try and raise all of her fingers, there would be a sag in the middle finger. So what we did is when we went in to take out the plates, we brought that tendon kind of back together, and we call plicate it, trying to bring it back, shorten it up a little bit, and then tie it to some other tendons that have the same function to give her a little better extension of that middle finger.
I take it she's not healed at this point in time, but you are still in the process of getting her better and better as best you could.
So Abby's hand is never going to be a normal hand. It's not going to be like her other side. But we've got it pretty darn close, and a lot of it's attributed to how hard she worked with therapy to do that. I mean, you can do a perfect surgery. If the patient doesn't do any therapy, they're not going to get a good outcome. So she's done a lot of work. I think she's done remarkably well with the number of injuries she's had there, but it's never going to be a normal hand.
I take it you did surgery again in October 2023? I
think that's the one where we took it out.
And that would be MV9?
That's the one where we found the adhesions.
It's on your TV screen, I believe.
Oh, yeah, that's the one where we took out all the plates and did the tendon work for the lagging tendon.
All right, so in A, as I'm looking here, all of these plates have been put aside. And are you in the process of taking out the plate on the right?
Yes, sir.
All right, tell me why you're taking out that plate and what's that leave for purposes of her bones?
So, if you've got a plate on a bone, and you can imagine this tendon riding back and forth over top of that bone over time, they can rupture. And there's a lot of stuff in there. Those that were sitting right over the tendon repairs. So it made sense to take out the plates at that point in time, especially when we were going to go ahead and do the plication of the tendon.
All right, let's look at B. Same section, same slide. I take it this is the thumb plate?
Yes, sir.
And have the same issues of concerning the tendons rubbing against the plate over time?
Yes, sir.
Could you tell the jury, please, what is Abby's hand like now 10 months post-surgery once you've removed these plates? What is the condition of her, the hand?
The bones are still healing. They're not healed up all the way, but we have seen union of the middle finger. But she's still got pain with motion. Still a lot of pain is related to the soft tissues.
All right, so tell me, and I think that you can go back to the main slide there. Is this your last surgery with Abby?
Yes, sir.
23?
Yes, sir.
And when you saw her in 23, how would you describe her condition?
So she was having pain at the base of, kind of in this region right here. It was hard to tell whether that was from the index finger bone not healing all the way, where there was no joint and we had to fuse it back to the trapezoid, or whether it was arthritis in the base of the thumb.
And why couldn't scans, x-rays, MRIs, whatever, why couldn't that tell you?
Well, we did do a CT scan and showed there was a clear non-union there, but these are, a centimeter apart, and it's difficult to tell on physical exam which was which.
Tell the jury, please, what does non-union of that bone mean in that area?
There's fibrous tissue in there, and it's not bone that's healed all the way across the fracture.
And how would that affect Abby in using or trying to use that hand with regard to pain or discomfort when there's a non-union of a joint?
When we tend to have non-unions, it's painful. Moving things with non-unions causes just a tiny bit of motion at that area, and the tissue around the area is what causes the pain. And so anytime you'd use that, you'd feel some pain.
Now, did you decide to do something with regard to this area of her body with regard to a future surgery?
So I would have been happy to just bone graft the non-union. However, I don't do base of the thumb arthritis surgery. That's really a surgery that's done by hand surgeons for arthritis.
All right, I want to bring in now trial attorney Alexis Rosenberg joining us for the hour. Alexis, always great to have you on. Thank you for joining. And listen, he's been going on for quite some time about the extent of the hand injuries, but I think the point is made. You can't really just give half the information because of the extent of the hand injuries that the plaintiff wants the jury to have in mind as they're deciding whether or not the assistant principal is responsible for the shooting.
So this is a civil case. So this is much different than a criminal case. And with negligence, it's based on negligence. It's really two parts, in essence. One, they have to prove that the assistant principal was negligent. They're saying extremely negligent in this case, as well as they have to prove the damages, and they have to prove the amount of damages that the jury is going to award. So that's why we kind of have this testimony going on and on and on. So the jury has a full understanding of not only what she's been through, but also what future medicals she may need as well.
And it's so significant to me, it really stands out, because when you see the plaintiff, a beautiful young lady seated at the table, and you hear she had a hand injury, she had a collapsed lung, it's different than hearing all the details, the extensiveness of this injury and future, as well as the prior doctor who was the surgeon who testified that, number one, she still has a bullet in her. Number two, that means she can never have an MRI, which is a diagnostic tool, including things like for breast cancer, that the extent of her injuries and the scar tissue mean it's going to be difficult if she ever has a traumatic injury on one side of her body for them to do surgery because of the scar tissue. You put all these things together and it paints a very different picture.
Well, this is the plaintiff's attorney has to do this because the jury is going to decide that dollar amount. So they need to prove, they actually have the obligation to prove this and present this evidence so the jury is able to do that. What's also interesting about this case is, remember, this happened at work. So this whole case is an exception to the fact that she's not can only just claim under the workers' comp. So that's what kind of is an interesting twist also about this particular case, which would significantly reduce the possible award to her.
Oh, great point, Alexis. And I think the plaintiff is doing a masterful job putting all of this out as they have to do in a civil case. Stand by, if you would, please, ma'am. We're going to have more of the first grader shoots teacher civil trial after this break. Plus, an Irish firefighter was found guilty last week of raping a woman over the St. Patrick's holiday weekend. Now, tomorrow, he faces his sentencing. Our own Matt Johnson joins us live next with what we can expect from tomorrow's hearing. Stay tuned. Welcome back to Court TV Live. I'm Ashley Wilcott. Before we head back to court in Virginia, we want to bring you a quick update out of Massachusetts, where Terrence Crosby will be sentenced tomorrow. You may recall we brought you the trial. A jury found Crosby guilty last week of raping a woman in Boston at a hotel. Crosby, a 39-year-old Dublin firefighter, was visiting Boston to walk in the St. Patrick's Day parade. Joining me live in studio, Court TV crime and justice correspondent Matt Johnson. So glad to have you on set with me, Matt. And I understand there still may be some outstanding questions about the hearing tomorrow.
Court TV reaching out to the defense attorneys to see if we can get a little bit more insight about tomorrow's sentencing because there are a few wild cards, including these, will Terrence Crosby make a statement in elocution tomorrow before he's sentenced? That's his right. Will he take any sort of responsibility if he does so, or continue to maintain his innocence like he did on the stand? Because he does plan to file an appeal. Last week, Terrence Crosby was found guilty of raping a woman at a Boston area hotel back in 2024. A jury split in the middle of 6 men, 6 women deliberated nearly 15 hours for the 5-day trial before convicting him. Tomorrow, we could hear from Crosby's wife, who appeared to break down in the gallery during the reading of the verdict. And we could hear from the victim, who said this on the stand.
I woke up to somebody on top of me, inside of me, in his penis in my vagina, on top of me, telling me, you like this, he couldn't give this to you, I'll give it to you, he's a loser. I was focusing on getting out. I was focusing on getting to safety.
Remember, court order, we weren't allowed to show the victim's face during testimony. We expect that tomorrow, but her statement's going to be very different, right? Because we expect it to focus on how this incident from her rapist changed her life and what it's like to testify all these years later in 2 different trials. You know, that's traumatizing in itself.
I can't imagine, and her bravery, really, for coming forward in the
Absolutely.
first place and then having to tell her story twice. I can't imagine the emotion she'll be facing tomorrow. But tell us, in terms of him, what type of sentence might he be facing, Matt?
Another wild card, right, Judge Ashley?
Yeah.
To do with the judge, right? Does he throw the book at him? You know, Crosby is facing 20 years behind bars. Will the judge give him a max or a downward departure? We're gonna have to wait and see. The married father of 2 has been in custody since the time of his arrest, not able to bond out, and he has not been allowed to travel outside of the country, even if he had made bond. His defense attorneys appeared on opening statements with Julie Grant after the verdict was read, and they said this about an appeal. Take a listen.
There will be an appeal. We'll file our notice of appeal, likely just after sentencing on Thursday. And I know I've been in touch with Mr. Crosby's wife. She's already asking for recommendations and looking into potential representation for that.
Okay, so sentencing tomorrow morning, 9 a.m. Eastern. Of course, we're going to be covering it. We're going to be watching it very closely. But, you know, a lot of questions, or wild cards, as I put it.
Yeah, absolutely. And will he say anything or not? We don't know. I can't wait to watch and find out. Thank you, of course, Matt Johnson. Right now, let's head back to Virginia for the civil trial between former teacher Abby Zwerner and the assistant principal she is suing. That is Ebony Parker. On the stand right now is still an orthopedic surgeon detailing Zwerner's hand injury that was significant after she was shot by that 6-year-old student.
That's really a surgery that's done by hand surgeons for arthritic conditions, just like a joint surgeon does knees and hips, a hand surgeon does base of the thumb arthritis. So at that point, I felt that the best thing to do would be to send them to somebody that could treat both of those problems if both of them needed attention.
Once someone went in and opened up the hand, they'd be able to see what the scans may not show and then operate on whether it's arthritis or something else.
Yes, sir.
Did you have a doctor in mind when you did that?
So there's a doctor up in Richmond, Dr. James Stewart, who's widely recognized as he takes on a lot of difficult cases and referrals. And so I called him and said, you know, can you take a look at this and tell me if you think it's the base of the thumb or if it's the index finger non-union. I'm happy to do the index finger non-union, but if it's a base of the thumb arthritis, it's something I'd like to have you take care of.
And as far as you know, he performed that surgery in 25?
Yes, sir.
And you have seen his medical reports since that surgery? Do you know if you did?
I think I've seen, so Abby would come back and follow up with us, so I seen, but I can't recall whether I actually read his op note or not, because I talked with him. I was like, what'd you do?
Right.
So I knew what he did, but I can't remember if I actually read the op report or not.
Now, you already indicated that Abby's hand is never going to be normal,
yes,
like her other hand. First of all, let me ask you whether or not all of your opinions today are stated with a reasonable degree of medical probability.
Yes, sir.
And all of your opinions today relate to her being shot on January 6th of 2023, all
Yes,
caused by that.
Yes, sir.
Now, when you say that they're permanent, what sorts of problems is Abby going to have, even understanding that she had surgery in 25 for the thumb? What sort of permanent injuries does she have now and will continue to suffer?
She'll certainly never have the exact same range of motion as the other side, never the same mobility. We've fused joints. There's more scar tissue in there than the hand that's not been injured. She'll probably have some component of chronic pain over time.
Does age help or hurt an injury like this?
Being young allows your body to be more resilient than if this had happened to you or I, but certainly a devastating injury is a devastating injury.
What happens when she's 50, 60 years old? What does that do to these injuries?
So she'll be at risk for having some of those tendons rupture as they rub over healed bones and things. Tendons may continue to attenuate. She's had some, color changes to her skin and things based off of probably some of the nerves that were injured in there.
If I could, Your Honor, could I have the doctor just step down and point out to the jury with Abby's hand so the jury can understand where the surgery is and what's left, because how it looks now and why does it look so different?
Yeah. Any objection to that?
No objection, Your Honor.
All right. Be careful stepping down. And Ms. Douglas, if you wanted to step up, that's fine as well.
But Doctor, why don't you do it over here so the jury can see, and I just wanted you to point out what you've done and tell me what the hand.
So first, when we look at the back of the hand, would you want to come over here? So you can see that there's kind of a little divot in the back of the hand. That's where some of the soft tissue is lost. You can see the entrance and the exit ones are up here. If I ask her to move the hand dorsally, there's going to be tightness in there. If I ask her to flex it, there's going to be tightness in there. You don't see a lot of color change now, maybe a little bit darker here, but as her nerves fire, they can cause blood vessels to expand or contract, and that somewhat gives her those color changes. Although this is better than it was, the ability to extend that middle finger all the way is not perfect yet. We can make that. And so you do the other side as well. And so certainly see that she doesn't have the ability to bring the fingers down all the way. Then you can see on the inside here where we did the surgery there, that's where we do a carpal tunnel surgery and remove that. There's certainly, if you can compare both sides, there's a lot of thickening in there where there's scar tissue. And if you bring the fingers and spread them apart, she doesn't have the muscles that spread your fingers apart are called the interosseous muscles. She's not able to fire her interosseous. Don't bring the fingers all the way apart like she has on the other hand. Right?
What about strength?
Oh, so grab both my fingers here. Just grab your hole and squeeze as hard as you can. This side would be considered normal. This is less than half of what I'm feeling on this side, and I think some of the occupational therapy did some strength testing, but I don't recall exactly what those were.
Sitting here almost 3 years after the shooting, do you believe that she's going to get that range of motion or strength back to any significant degree from where she is today?
She may make some slight improvements, but I don't think she's going to make drastic improvements and have her hand be like the other hand at this point.
Doctor, you can take the stand again. I'm not certain that I have left anything out, but I want to ask before I sit, if I could, for 1 second, Your Honor. Doctor, please answer any questions that counsel may have of you. Thank you very much for your time.